Welcome to our third session, right? I think previously we ended so reluctantly. Suddenly we ended, but no problem. We'll just continue with it. Just continue from where we stopped, right? Yes, so we stopped at Crigler-Nazar syndrome, phase 2 metabolism. What is the phase 2 metabolism? What happens in phase 2 metabolism? In the phase 2, the body makes the drug or converts the drug to a water soluble, water soluble. What is the most common reaction? Glucuronidation. What is the most common reaction in phase 1? Oxidation. Remember this. It is an MCQ which was given in 2019 NEET PG. Very important direct question. Okay. Most common enzyme of phase 2 reaction is glucuronidation, and most common enzyme in phase 2 reaction is glucuronyl transferase deficiency leads to what? Crigler-Nazar syndrome. What happens? They causes drug toxicity of atazanavir and which one? Irinotecan. Okay. Now, what happens if the enzymes present in these metabolisms, if they were induced, these enzyme inducers or enzyme inhibitors? If these enzyme inducers were given unknowingly, these enzymes, obviously, what these enzymes do actually? They metabolize the drug. Now, if you give the enzyme inducers, obviously, what happen? The enzyme gets activated. The enzyme's activity gets increased. What happened? The enzyme activity gets increased, thereby leading to increased or fast metabolism of the drug. Now, if the drug metabolizes fastly without even completion of the action of the drug, if the drug gets metabolized, obviously it leads to drug failure. I think you got my point. Now, if enzyme inhibitors were given, now what happens? The enzyme gets inhibited. If the enzyme is not there, the reaction or the drug will not be metabolized. But if the drug metabolism will not occur, the drug stays forever in the tissues and it may lead to drug toxicity. Now, can I tell you in one more example? I will tell you in a direct example. You just hear this. For example, a boy and a girl, they were married. So after marriage, what you will have? You will have first night. After marriage, what you will have? You will have first night. Now, if you give the enzyme inducers, who are the enzyme inducers? Elders. If the enzyme inducers were present with the husband and wife, they will keep all sort of old culture. What they will do? You should keep muhurtam for the first night. You should bring the so-called, who is that? Pantulu. You should bring the Pantulu or the God's servant in order to confirm the time for first night. So these elders are the enzyme inducers. If they induce, what happened? It leads to drug failure. What fails here? First night fails because they are the enzyme inducers. Now, if you give enzyme inhibitors, If you give enzyme inhibitors, who are the inhibitor? Friends. Friends always support the boy. So the first night goes forever. First night goes forever. It will become a toxic first night. The first night goes forever. Toxic first night. For days and days they go on with the first night. So enzyme inducers lead to drug failure of the first night. Enzyme inhibitors leads to drug toxicity. Means the first night goes forever and ever. No one will be there to stop the first night. The husband and wife will be remaining in the room. They will get remained in the room forever and ever, and the first night goes on for decades and decades, like a serial. It goes on for episodes and episodes and episodes, right? So that is a simple example. Remember this. Okay. Now if you ask me what is a best example of enzyme inducer, if you ask me what is the best example of enzyme inducers and enzyme inhibitors, if you ask me some examples of enzyme inhibitors and enzyme inducers leads to drug failure, enzyme inhibitors leads to drug toxicity. What are the examples for enzyme inducers? I will give you one mnemonic. Grab Priyanka Chopra, but don't grab Priyanka Chopra. Why? Because who will get angry? If Priyanka Chopra is caught? If Priyanka Chopra is grabbed by someone, who will get angry? Nick Jonas will get angry. So don't grab Priyanka Chopra. You will grab Priyanka Chopra only for enzyme inducers. Don't grab Priyanka Chopra, please. We will grab Priyanka Chopra only for enzyme inducers. G for griseofulvin. R for rifampicin. A for alcohol. B for beta blocker. B for benzopyrin. I am extremely sorry. B for benzopyrin. And P for not Priyanka, P for phenytoin. And another P is primidone. And another P is phenobarbital. P for not Priyanka, P for phenytoin, phenobarbital and primidone. And C for carbamazine and cigarette smoking. Not Rajnikant, it's cigarette smoking. So Rajnikant is a enzyme inducer. Cigarette smoking is a enzyme inducer. If the enzyme is induced, it leads to failure of the drug. The drug gets failure. Now enzyme inhibitors. What are the enzyme inhibitors? Quick veg dish. This is the mnemonic. Remember, you went to a hotel and you quickly ordered a vegetarian dish. What is that quick vegetarian dish? Quinidine. And what is the another one? Isoniazid. Guys, sorry, I think you should this you will get confused, right? Sorry, quick vegetarian dish, right? Q for quinidine, I for isoniazid. What is isoniazid? Isoniazid is the first line drug for which disease? Tuberculosis. What are the main first line drugs for tuberculosis? HRZES, pyrazinamide, rifampicin, isoniazid, ethambutol, right? So these are the first line drugs and inhibitors of protease. Inhibitors of protease. Inhibitors of protease. Now C for what is that? Cimetidine. And another C is chloramphenicol. Next, ciprofloxacin. Next, K for ketoconazole, antifungal drug. Ketoconazole, itraconazole, fluconazole, candidiasis, drug used for candidiasis, fluconazole. Now quick wedge, quick wedge. Just 1 minute. I think we have quick wedge. V for valproate. There's some space here. Valproate. Next, E for erythromycin or clarithromycin. Next, G for grape. Sorry, I think you can't see here. G for grape juice. You drink grape juice after a meal, right? After having a heavy meal, you will take grape juice. So G for grape juice. D for diethyl carbamazine. DEC. Short form is DEC. Diethyl carbamazine is the drug of choice for filariasis. Remember. Another D is dilaverdine. Guys, these are very important drugs. We will discuss in the next class. Dilaverdine, right? And another D is disulfiram. Disulfiram is a drug given for addiction, smoking addiction. Disulfiram, okay? Now, we'll discuss something about plasma esterase, drugs which are metabolized by plasma esterase. This plasma esterase enzyme we will discuss in the later classes, right? But just remember the drugs which are metabolized by the plasma esterase. Why? Because you may get a potential MCQ. What is a mnemonic? Mnemonic is plasma esterase can readily metabolize short acting drugs. Plasma esterase can readily metabolize short acting drugs. Guys, this is a mnemonic. Please remember, you will get an MCQ in INICET or in the NEET PG for sure. Metabolize in short acting drugs. Plasma esterase. So what are these examples? P for cocaine, and E for esmolol, C for clevidipine, R for remifentanil, remimazolam, M for mivacurium, S for succinylcholine, and A for acetylcholine. Acetylcholine is the neurotransmitter for cholinergic ones, and adrenergic drugs and adrenergic system you will be having a which neurotransmitter as main neurotransmitter is norepinephrine, right? Norepinephrine is the main neurotransmitter in adrenergic system, and the choline system you will be having acetylcholine as the main neurotransmitter, acetylcholine. Guys, actually we have some important things that we should speak in the next classes, that's for sure. Now we will discuss something about potency. I think we discussed about potency yesterday, a day before yesterday. Potency, what is meant by potency? Potency means the lowest, the minimum dose of the drug which can, the lowest dose of the drug or the minimum dose of the drug to produce a particular effect, that's called the potency of a drug. The minimum, the lowest dose of the drug needed to produce a particular effect. For example, you take a blocker. Now the least amount of this blocker, least dose of this blocker which is needed to produce its required blocking action on a particular receptor, that least amount or the least dose of drug of this blocker needed is termed as potency. Means the least the drug dose it is, the more potency it has. That is, that defines potency is inversely proportional to 1 by dose, inversely proportional to dose of the drug. The least the dose of the drug is, the higher or the more the potency is. For example, I think we will just do with a small graph. We'll just discuss with a small graph, right? For example, this is the, say it is a action effect. This is the dose, right? This is the dose. This is the action, or it is the effect. Now there is a drug A, there is a drug B, there is a drug C, there is drug D. Now drug A, I think wait. This is the effect and this is the dose. Now drug A has given the effect at this dose. Drug B has given or exhibited its particular effect at this dose. Drug C has given the effect at this dose, and drug D has given the effect at this dose. Now if you ask me which is the most I think we should get some colors, right? Okay, leave it off, no problem. This is A, B, C, D. Now if you ask me what is the most potent of all these 4 drugs, A, B, C, D, if you ask me which drug has produced its respective effect at its minimum dose, at its lowest possible dose, that is the most potent drug. Now which drug has produced its respective effect at its lowest possible dose, that is A. So A is more potent than B, more potent than C, and more potent than D. This is the potency in case of potency. But if you ask me in case of efficacy, efficacy means what? The maximum effect a dose can produce. What is the maximum effect that a given dose of drug exhibit? What is the maximum effect, right? Maximum blocking action, maximum inhibiting action, maximum detoxifying action. What is the maximum effect that a drug can produce at a particular dose is defined as efficacy. Now, which drug has produced the maximum effect? B, followed by A, followed by C, followed by D. This is the order. You get my point? If it's okay, I will clear it off. Okay, now we'll discuss something about dose response curve. Response curve. We'll make it a little bit fast, otherwise the topics will be delayed, right? Now, there are two things regarding this. This is quantile dose response curve and graded dose response curve, right? Quantile dose response curve and graded dose response curve. Most of the doctors get confused in this topic. They get confused because they listen to different discussions. See, I don't make it complicated, but I will just make it simple. Quantile means simply yes or no. It is just a binary decision. That's it. That means whether it has given the sedation or not, whether it has obtained the sedation or not, whether the patient has secured pregnancy or not. So that sort of response is defined as quantile dose response curve. It has only two variants, it has only two options, either it is yes or no. But graded means the response will be graded. The response will be graded according to the effect the drug has produced. According to the effect the drug has produced. The quantile dose response curve is seen in a population. Why? Because say a drug name A, whether it has produced effect or not in first individual, yes. Whether it has produced effect or not in second individual, yes. Whether it has produced effect or not in third individual, yes. Whether it has produced effect or not in fourth individual, yes. So a dose response curve is seen in a population because a one drug, a single drug is being done on a multiple individual. It's been done on a multiple individual. So a quantile dose response curve is seen in a population, while a graded dose response curve is seen in a individual. This dose response curve is seen in a individual because it is graded. It's not seen in a multiple individual, it is seen in a multiple individual only. For example, a drug namely X given to a patient at so and so dose, it has shown this effect. At so and so dose, it has shown this effect. At so and so dose, it has shown this phase of effect. At so and so dose, so it will shown different doses. For example, at 0.2 dose, it may cause light dizziness. At 0.4 dose, it may cause reverse phenomenon. At 0.6 dose, it may lead to some other phenomenon. So it will show a graded response depending on the dose. So a gradual dose response curve is seen in an individual. Graded dose response curve. Graded dose response curve is seen in an individual, while a quantile dose response curve is seen in a population. Okay. Now we will go to other topic. Okay. Now we will take a graph. Listen carefully, guys. We will take a graph. Right. I don't like this much thick lines. We'll make it even more thicker. Okay. Are these two lines similar? Okay. So okay, fine. Something is better than nothing. So in case of quantile, in case of quantal dose response curve. In case of quantal dose response curve. Case of quantal dose response curve. In case of quantal dose response curve, what you will see, this is percentage population. Now you have a drug, right? Now you have drug which is given to the population, Now this is the percentage population and this is log dose. This x-axis is log dose and the y-axis is percentage of the population. Now the dose at which the drug shown effect in 50% of the individuals. The dose at which the drug shown effect in 50% of the individuals. So this is 50% of the individuals, right? This is 100% of individuals. This is 50% of the individual. The dose at which the drug shown effect in 50% of the individual, that is called as effective dose. Effective dose means the dose at which, the dose of the drug at which, or the dose required to produce effect in 50% of population. The dose of drug that is required to produce effect, its respective effect in 50% of population, it's called as effective dose. The dose which cause toxicity in 50% of the population is called toxicity dose. That's called toxicity dose. The dose which is required or which may produce toxicity in 50% of the population is called toxicity dose. Now the dose which caused 50% of deaths in animals is called lethal dose. The dose which caused 50% of the deaths in animals is called lethal dose. 50% of deaths in animal. Don't write population, it will be a murder, mass murder. So in animals, 50% of deaths in animals is called dose required to produce or kill 50% of animals is called lethal dose. Now this lethal dose, guys, listen, very important. The lethal dose is the marker of toxicity. Please underline or write this statement somewhere. It will be a potential MCQ. This lethal dose LD50 is the marker of toxicity. Okay, and this toxic dose is also the marker of toxicity, and ED dose is the marker of potency. ED dose is the marker of potency. Remember, effective dose is the marker of potency. Okay, now that's okay. Now we will go to graded dose response curve. I think this class looks too boring, but please stay with me, right? This will be a good class, trust me. It will help you for sure, right? You just listen the class, sit, relax, man, and enjoy the class. What's there? No need to do any labor work. No, you just listen the class. It's somewhat benefit, somewhat helpful, right? Just listen the class, enjoy the class, right? I may not give some jokes, I may not do some sort of jokes here, but still it will be a good class and it will be helpful. Now this is response. Y-axis is response, x-axis is log dose. Now in case of a graded dose response curve, what you will see, right? You are testing in a single individual. In a single individual, a drug X which is given at a particular dose and a drug B is given at a particular dose and a drug C is also given. A, B, C. Okay. Now you say take it example as A as enalapril, B as captopril, and C is nifedipine. So here, did you just observe one thing? Here you took only one drug X and you were given to multiple individuals. That is a group of members called population, and you deciphered all its effective dose, toxic dose, lethal dose. But here, only in a single individual, you were given three drugs: enalapril, captopril, nifedipine, which was named as A, B, and C. Now they produce different effects at different doses in a single individual only. So this is seen in a graded dose response curve. Now taller the graph, higher is its efficacy. Means taller the graph, the effect produced by the drug is more. That implies the drug has produced more effect. The taller the graph, more effect it has produced. So what is the potency? Previously I already explained what is meant by potency. The lowest minimum dose required to produce a drug effect in the patient or in the individual. Now what is which drug has performed its action at its least possible dose? Drug A, followed by drug B, followed by drug C. So A at its least or minimum possible dose produced this effect, followed by B, followed by C. But if you ask me efficacy, what is meant by efficacy? The maximum effect. The maximum effect a drug can produce has maximum efficacy. Now if you ask me efficacy, obviously it will be B greater than A greater than C. Taller the graph, high is the efficacy. More left side is the graph, it has high potency. More right side is the graph, it has least potency. Okay na? Okay, so lesser dose, more potent. That means more the graph left side, more potent is the drug. Okay. So affinity is simple. See, here drug A has more affinity than B. Why? Because at the least minimum possible dose, the drug A, so called enalapril, has already started its action, but the drug B has needed more amount of dose. Drug B needs more amount of dose to perform or to exhibit the same action, but B has more efficacy. A has more affinity towards the receptors, but B has more efficacy. You just don't confuse. Affinity can be compared only if the two drugs acts on the same target. Okay. Only if DRCs are parallel. Right. Now we'll discuss something about therapeutic index. Right. Therapeutic index. Don't think I am getting sleepiness. No. Right. I am just warming up. Therapeutic index. What is therapeutic index? In case of humans, therapeutic index is measured by toxic dose in 50% of population by effective dose in 50% of population. TD by ED. But in case of animals, it is LD by lethal dose in 50% of animals by in 50% of animals. So therapeutic index is the measure of drug safety range. So my statement is very much simple, that more the therapeutic index, more safety. Low therapeutic index, low safety, or high risk or side effects can be produced by the drug, right? So if the therapeutic index is more high, if the therapeutic index is high or more, then it is more safety, the drug is more safe. But if the therapeutic index is low, that implies the drug has low safety profile, or it has the high chances of producing side effects or high risk drug. Okay, now we will discuss about therapeutic window range. Therapeutic window range. Don't think like SAR is going like a river water, just moving on like that. No, you just stick with me. You will, obviously you are with my flow only. Okay, obviously you are in my flow. Don't think like that. Okay, I'm just going freely like a river. You just swim in that river, that's it. It is very much really enjoyable. You just swim in that river, nothing much is needed. Okay, everything will be set right. Now I took a line, I just kept it like this. Okay, now I'll draw here what it depicts here. It is the plasma concentration. It's the plasma concentration, followed by this is what? Dose. Plasma concentration followed by time. Now I have given a drug, it reaches a particular concentration, maintains a steady state. After some time it gets excreted and the plasma concentration gets decreased as the time goes on. Now this line here defines, it is the minimum effective concentration. It's called MEC, minimum effective concentration. Can anyone tell me what is the minimum effective concentration? What is minimum effective concentration? The drug effect can only be seen above or only beyond the MAC. The drug effect can only be seen beyond the MAC. Effects can only be seen. Now this is the minimum therapeutic concentration. This is the minimum therapeutic concentration. Therapeutic concentration means the drug toxicity begins from this line. Drug toxicity begins from this line. Toxicity begins beyond this MTC. Now this range between MTC and MAC, this area is defined as therapeutic range. Now beyond this line, here the drug effect starts. Beyond this line, here drug toxicity starts. So this area in between this MTC, minimum therapeutic concentration, and this line, minimum effective concentration, the area between these two lines is the therapeutic range. Means this one is the therapeutic range. This area is the therapeutic range. Okay, you got my point? Now we learn about drug receptor interaction. Sometimes we'll use colors. Why? Because people will get bored. Why SAR is using all black color only? SAR is not using colors. Maybe in SAR life there are no colors itself in SAR life or SAR mindset. No, I have so many colors, right? If you want, I will draw some flowers for you. You see those flowers and enjoy, right? Joking. My drawing is very much absurd. Leave it up. We will discuss something about drug receptor interaction, right? See, keep your mind here, right? Don't distract. Now there are some definitions that you should not only learn, you should apply each and everywhere. What is a agonist? Agonist means which produces maximum effect. Maximal effect. Guys, first you should know what is meant by agonist, partial agonist, antagonist and inverse agonist. Okay, just listen. It might look like basics for you, but still it's only for understanding. Okay, just listen. Agonist. See, the mean, just by explaining the meanings of these terms might look childish for you, but still it helps you for a better revision. Always start with the preliminary, man. Why you want to feel like that? Always starts with the preliminary. That will give you a good foundation. Always starts with the preliminary. Okay. Agonist means your parents, daddy and mummy. Okay, they support your effect. What you do, they will support this. What you do, they will support the action. So there is agonist. So which supports or which produces the maximum effect, which produces the similar effect, that a substrate does, is called agonist. For example, B produces blocking. A chemical compound B produces blocking. Now, if the same action done by C, when it's been applied on the particular receptor, it's an agonist. It's an agonist, right? Same action, presenting the same action, similar action. What is antagonist? Wife. Wife is the antagonist. Parents are the agonist. Wife is the antagonist. What is an inverse agonist? Why wife is antagonist? Because it always obstructs your action. It gives resistance to your action. So it is antagonist. Okay. Now inverse agonist means children. What you do, they will do the reverse thing. What you perform, they will do the reverse thing. Reverse thing is done by children. Why? Children do all reverse things. You want the children to be disciplined, but they become naughty. You want the children to read or educate or to have a good academics, but they get zeros in the progress report. So children are the inverse agonist. Who is a partial agonist? Friends. Sometimes they support you, sometimes they backstab you. That's why they are partial agonist. Sometimes they support you, sometimes they backstab you, or they give hand to you. So that's why they are partial agonist. Now you got my point, right? So a full agonist is something which supports completely and produces a maximal effect, so it can be taken as one. Partial agonist, that is friends. Sometimes they support you, sometimes they backstab you. Partial agonist shows submaximal effect, a little positive effect. Submaximal effect, partial agonist. That is from 1 to 0. Sir. That is from 0 to 1. That is from 1 to 0. Plus 1 to 0. Okay. Now antagonist. This is the most common feature that most of the drugs exhibit. That is antagonist. Antagonist is wife. It blocks. It simply blocks. It blocks the effect. It will not show. It will make sure that you will not show any effect. It will block your effect. So it will not show any effect. So 0. Wife is an antagonist. Inverse agonist. Children. Everything done in reverse. Actually you want adrenergic property, but what happened is anti-adrenergic property or adrenergic blocking property. So you want adrenergic supporting one, but you got adrenergic blocking one. So it is inverse agonist. It is almost something like antagonist only. So it shows opposite effect. But see, I just want to tell small concept here, in which type of drugs this inverse agonist type of action can be seen perfectly. For example, you want a drug to produce diuresis. Instead, what the drug has done is water reabsorption. So obviously the drug is a inverse agonist. The drug is a inverse agonist. Actually diuresis should happen, but what has happened? Water reabsorption taken place. So it has shown an inverse agonist action. It has exhibited inverse agonist or opposite action or opposite effect. Okay, now this can be shown from 0 to -1 because it has shown minus, it has shown reverse. Now if you show these 4 actions on a graph, how it will be? We'll just look into it. If you show this 4 actions on a graph, 4 types of actions on a graph, how it will be? Yeah, right. Now what are the 4 things? Right, here, just wait, and we'll keep it here and we'll just extend this line further. Okay, now we'll just see the actions of these 4 types of actions. Now what is agonist? Agonist is something which supports you completely. Agonist is something which supports you completely. It shows you the maximum support, it shows you the maximum effect. So that is called a agonist. Now it ranges, it shows +1, A grade. Okay, shows +1. This is a full agonist. We'll just name it as full agonist. Now next one is partial agonist. Now what is next one? It is partial agonist. Wait, partial agonist. So it shows from +1 till 0. It shows in between those values. Now the next one is, what is the next one? Antagonist. Completely blocks you. Antagonist is who? Wife. Wife is the antagonist. Remember, wife is the antagonist. Completely blocks you. Wife. Very dangerous antagonist. Remember, so we will give 0 to wife. She is an antagonist, she completely blocks you, remember. Okay, and finally inverse agonist. Oh my god, children, inverse agonist, a big headache. What you expect, they will do everything in reverse. What you expect, they do everything in reverse. Inverse agonist. So it will be from 0 to -1. It will show a value from 0 to -1, but not like that. I want to tell one thing, I love my children more than anything. Okay, children may do things in a reverse manner rather than what you expect, but still Children are the most beautiful, gifted things of nature. So love your children more than anything. You have health, you have wealth, you have money, you have riches, everything, but still you have a children, then surely you are the most luckiest person on this planet. Trust me, children are the most lovable things and most lovable reflection of the God. So always love this inverse agonists. Okay. I'll go to the next one, that is types of antagonism. This is very important. Why? Because most of nearly 90% of the pharmacology revolve around the antagonism property. What is the graphical representation value of antagonism? 0. Who is their antagonism? Wife is our antagonist, so value we will give is 0. Okay, what are the types of antagonism? One is physical or pharmacokinetic. Physical. Second one is chemical. Third one is physiological. And fourth one is competitive or pharmacological. Now, physical antagonism is observed where, in which example? For example, alcohol, which is given in alcohol poisoning, where we give charcoal as an antidote. So it absorbs the alcohol component. So it physically absorbs the alcohol component. It just absorbs it. So it's a physical antagonism example. Now chemical antagonism, where you will see heparin poisoning, where you give protamine sulfate as antidote, because it exhibits a chemical reaction to simply what? Detoxify the heparin. As well as in iron poisoning also, you give what? Desferoxamine, right? Physiological, what you will see? Histamine, which are actually bronchoconstriction. Histamine causes bronchoconstriction. Whereas physiologically histamine causes bronchoconstriction, because histamine itself is released in our body by the very own mast cells which secrete histamine, or which releases histamine, which causes bronchoconstriction naturally. Physiological only this histamine is released and they cause bronchoconstriction, and physiologically only adrenaline is released on our body, which in turn cause bronchodilation. So this is an example of physiological antagonism. Physiologically histamine releases in our body which causes bronchoconstriction, but physiologically adrenaline itself releases in our body, which in turn produces the opposite of bronchoconstriction, that is bronchodilation. But if you ask me, competitive antagonism is a brief thing, so we will discuss briefly. Competitive antagonism, guys, listen this topic. This will be a potential MCQ. This is very important also. Non-competitive antagonism. Competitive antagonism. Competitive antagonism and non-competitive antagonism. Okay, competitive antagonism and non-competitive antagonism. Okay, what happens in a competitive antagonism? So before drawing the graph. I will just show you one thing, right? Just remember, this is a receptor, right? Receptor side. So we have a main drug and another competitive one. Now A is the main drug and B is the competitive one. So what happens is, they have similar shape. So if only A is present, it goes and it binds in its respective receptor site, and obviously it produces its action as the output. But what happens is, in fact, just wait, I'll show you. What happens is, in fact, this is the receptor. This competitive B, right? This competitive substance will come and bind here. Because they have the same receptor site shape, same shapes. They have the same molecular component shapes. They are exhibiting the same molecular composition shapes, which leads to antagonism, blocking of the property. So the B goes and binds to the receptor site instead of A. This is called as competitive antagonism. This is called as competitive antagonism. So what is non-competitive? Non-competitive means you have a receptor, but you have two sites. So here the actual drug will bind, but on the other side what happen is, and another component with that type of site molecular structure. That means you have site A, site B. At site A, the actual drug gets binded. But what happens is, at site B, another drug which resembles the site B receptor site gets bind to it. It gets attached there, thereby causing disruption in the action of A. So here, see, you have to observe one thing. In competitive inhibition, the binding of A is completely prohibited. Instead, drug B has binded instead of drug A. So drug A cannot bind there. It's completely prohibited from binding. So it is a competitive thing. So there is a competition between A and B. Who will bind to the receptor site? Ultimately, B binds to the receptor site. But in case of non-competitive, there is no competition between A and B, because you have a space for A, you have a space for B also. So there is no need of competition. Both of them can happily bind to it. But what happening is, the action that is actually being done by the A, if it is present solo, if it is present in single, is being disrupted due to the interruption that is caused by the binding of the B molecule. So it is non-competitive. There is no need of competition between A and B, because they have two sides, so that A can attach and B also can attach. So what happened here is, what type of antagonism occurs is, the binding of B unnecessarily to the second site on the receptor, it causes disturbances in the action of A. It will not terminate the action, but it causes some disturbances because A is already bind to the site, so its action will not be terminated, but the action produced by the A will be decreased. Now you understand my point? So that is meant by non-competitive. So action of the A will be decreased in what? Action of A will be decreased in non-competitive antagonism. So what happens if the action of a drug decreases? What is known as, what is meant by maximum action produced by the drug called efficacy? The maximum action that is produced by a drug is called efficacy. But if that action is decreased, what is decreasing? Efficacy is decreasing. So the efficacy of drug A decreases, but its potency remains same because it has bind to the site. The A did not fail to bind to the site. That A has bind to the site, but its action has been decreased. The efficacy of the drug A has been decreased due to the binding of B drug on the opposite side. Whereas in competitive antagonism, what happens is the A has been completely terminated from binding. A has been completely terminated from binding because there is only one site and the site is being occupied by the B. So what the A should do? Now the A should increase its dose. Increase its dose. So more number of soldiers should attack and more number of receptors should be occupied by A. Ultimately it will reach its target, but the target action of the A can be only be reached by increasing the number of receptors to be bind, by increasing the binding quantity of the receptors. Previously A is to bind only for 2 receptors, but as one of the receptor has been bind by B, A has to bind for few more receptors in order to keep its action, quantity of action steady. So what it has increased? It has increased its molecules. It has increased its dose. So here dose of the A is increased, but its action after increasing the dose is same. You got my point? So here what remains same? Efficacy remains same in competitive inhibition. Here dose is increased. Actually only X amount of dose is needed previously when there is no B. But after the B has occupied, A has recruited many soldiers to occupy more receptors, so more dose is recommended, that is dose Y is recommended now to produce the same efficacy. So here dose is changed but efficacy remains the same. Now we will draw the graphs regarding competitive antagonism and non-competitive antagonism. Guys, listen to this very important topic. Don't neglect this topic. Even in I think in last 2021 INCT also you got a question on this. So please listen to this. So what here the dose gets increased but the action that it produces remains same. Here the action is decreased. Why? The binding is not terminated. A binded already, but what happened is the binding of B on the other side led to the decreasing of action of A, but the dose of A is still same, right? So if we draw a graph, you draw a graph, right, regarding the. So this is the response, this is the dose. So in this, dose remains the same, dose increases, right? Dose previously at this dose it produced the effect, but after adding of the antagonist, after binding of the antagonist, the dose gets increased but the effect remains the same. That means efficacy remains the same. So what has decreased? Potency decreases. I want to tell this point, right? So this is with drug, this is with drug plus antagonist. I just want to tell this point, so I am mugging up all this story. Whereas in case of non-competitive inhibition, what is happening? Non-competitive inhibition, action decreases, right? The action decreases. Wait, I will just write it clearly. Sorry, I just want to write it clearly. Here the action decreases but the dose remains the same, right? You can't show it like this. Wait, shit, this way. You can't show it like this. Actually we should show in two graphs. Why? Because the action remains the same, right? This is response, this is dose. So the action remains, the dose remains the same. This is with drug, but the action gets decreased, drug plus antagonism. So you observe something here. You observe something. The dose remains the same. The dose here remains the same. I will show it. The dose is same in both the condition, without antagonism, with antagonism, but the action is decreased. That means, in other words, we can write here what we will write. In other words, we can write here what we can write. The efficacy decreases but potency same. So in non-competitive inhibition, efficacy decreases, potency remains the same. Okay, I just want to tell that small piece of information, so I am mugging up all these things. Okay, I think there's still so many topics are there, but I just want to end the class here. Wait. Okay, I think we will end the class here. We'll come up with the next class tomorrow. We'll finish it as fast as we can, right? So guys, I just want to say one thing. Please kindly watch the complete video. You just like, subscribe and share this video with your friends, right? I may not be like as fluent, as informative like other professors or the teachers that you might know, but still I am trying my best to give or to share the knowledge that I have. So kindly, if you have any suggestions, feel free to write it down. I don't feel otherwise, right? Feel free to write it down. And if you want to discuss any topics, any new topics, see, we are going in a something like, yes, we are going in a straight, in a protocol or in a particular planned manner, but still you can ask me, sir, we want a particular topic. For example, sir, we want to know completely about pheochromocytoma, or sir, we want to know completely about aniside poisoning, we want to know completely about cardiomyopathy. If you ask me like that, I feel very much happy to explain to you, right? I will give you as best as possible. So kindly, please, my only request is, please watch these videos, please give it a thumbs up. See, your little thumbs up is a big favor for me. Kindly please like this video, share it with your friends, subscribe it, and if you want a particular topic, feel free to ask. I don't think otherwise, right? You just ask me, sir, we want this topic, we want about something like Menkes syndrome, we want about Menkes syndrome, or we want about Zellweger syndrome. So you just ask me, feel free to ask, right? And just will come as fast as we can. We'll meet once again. Till then, we will just end this part 3. Next class we will start with part 4. Sorry if I have left so many topics, but in the next classes I will finish it as soon as I can. So goodbye, signing off, your wise doctor. Thank you.